Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name is Erin from AmeriStaff Home Nursing, and today we have Lisa, a registered nurse of AmeriStaff Home Nursing, with us, and we're going to talk about adult immunizations. Lisa, we all know as children you have to get immunized for certain things, but there's also adult immunizations. And you hear on the news a lot, or you read in the paper that, especially the elderly are affected by influenza and flu. So maybe we can talk a little bit about the types of immunizations you need as an adult.
Sure. Well, first of all, you would ask your doctor, because there's several different reasons why some people really should receive the vaccine, especially those who are immunocompromised, people that have HIV, AIDS, diabetes, coronary artery disease. Those are just some examples. Lifestyle, sexual, if you're sexually active, if you, go out a lot and are exposed, around a lot of people. There's different vaccines that you can receive now for sexually transmitted, like the human papillomavirus, and that's generally women younger than 25 who've not had sex, it's a series of 3 shots. And with everybody knowing that the human papillomavirus is the #1 cause for cervical cancer and ovarian cancer. So that's a huge thing for our children to get. They can get it as young as 10 years old. So for the elderly people who are living in assisted living places, or even the workers that live in assisted living places, to protect the patients there, the workers can get the hepatitis A and B series. Also the pneumonia vaccine, and that's usually recommended at the age of 65 and above, or anybody that is at risk.
Now, is the pneumonia vaccine, is that a one-time or is that annual?
It's every 5 years. Yep. The flu shot is every year. And again, you can go on the CDC website, which is where I got a lot of information off of. Very, very helpful. There's also measles, mumps, and rubella. We've all had that as a child, our vaccines, but they're finding out now that people are losing immunity to. They're not being protected later in life, that they really need a booster. So in order to really find that out, you would need to go to your doctor, and they would do blood work, which is called a titer, and then your doctor would see where your levels are at. Especially if you're traveling overseas, if you're doing international travel, or you're going to be living overseas, then you definitely need to contact, go on the CDC website and see what you need for different areas of the world. They require different immunizations. Certain places that have a lot of whooping cough, where they are not protected and they are not required to get vaccinated. Depending on what country you're going to, your doctor would have that list on what vaccines that you would need to go to that country.
Now, how about the chicken pox and shingles, and those would also be things that you want to check?
That's a great question. Chicken pox, we've pretty much all been exposed to it as a child, had it. Whereas now, our children all get the vaccine as a baby, but they're also finding out that later they need that MMR booster, and maybe even later in adulthood. As far as the Shingles, the varicella is the vaccine you get when you're a child, and the booster when you're older. And then the zoster vaccine is the vaccine for shingles, which will prevent shingles later in life. And that's only for people who have not had chickenpox. So, and again, you just need to talk with your doctor about that, because once you've had chickenpox, it lays dormant in your body and then comes back later as shingles. So you just really need to follow up with your physician.
And you talked about living spaces where there's a lot of people, such as college dorm rooms. So what kind of vaccines would they need, say if they're going to come home and visit an elderly loved one, just to make sure that they're covered?
Right. Well, if you're especially a first-year college student living in the dorms, meningococcal vaccine to prevent meningitis is an absolute must. But again, they're adult age at that point, so it's really required. It's up to them, that they need to go to their physician. If they're going home and there's somebody that, if they're going back and forth from college to home, and there's maybe grandma, grandpa, or an immunocompromised person living in their house, they really should have the influenza every year, the pneumonia every 5 years, and definitely the meningococcal. And then again, follow up with your physician on any boosters that you may need. And then also, if your child is 18 and younger, you can contact your local health department, and they have a record of every immunization that your child's had.
Okay, well, that's good to know. Thank you, Lisa.
Thank you.
And if you have any questions about adult immunizations, you can always call us at AmeriStaff 248-288-2270.